Hello, my name is Elizabeth Steinberg. I am a board certified pediatrician and I am trying to address the most common concerns of children ages 0 to 18 years old and how to have parents take best care of their kids. If you have any questions or you want me to do a video specific to you, please let me know, and my office information is in the description below. For newborns, in the first 2 weeks of life, their umbilical cord falls off. Their umbilical cord is the connection between the baby and the placenta that is attached to the mother in the uterus. The umbilical cord carries all the nutrients, and as almost everybody knows, it's cut when they're born. There are some cultures that keep the umbilical cord attached to the placenta and then care for the placenta in a cloth, and this is called a lotus birth. And they have the placenta attached to the baby until the umbilical cord naturally falls off from the baby. And there is a process in which to remove the placenta. I am not familiar with this. I have heard of this practice. I would suggest that you consult somebody local in your area who could tell you more about this. But my concern with this would be that the placenta is a organ that needs to be not attached to the baby during this time, and I could see potentially a cause for concern with bacteria. So this would be something that, if this was something that you wanted to do, to talk to your healthcare professional, your pediatrician, and someone local in the area if you wanted to find out more about this. The placenta in itself, to go on a tangent away from the big umbilical cord, is a whole other process. Many people and cultures use the placenta for nutrients to help with breastfeeding. There's placenta smoothies, there's placental pills. I am not familiar with these practices. I have heard of these and people thinking about these as possibilities in their life. I cannot make any recommendations about this, but I am willing to talk to you if this is interesting to you. Going back to the umbilical cord, what it basically is a material that's gelatinous called Wharton's jelly, and then it has blood vessels in it, veins and an artery. And if you look very closely, you will see these structures in the umbilical cord. As the baby grows and is living its world on earth, the stub of the umbilical cord starts to dry up. So it's a sticky jelly solution, and then as the baby ages, the stub starts to get harder. So what happens is, as the baby's starts to grow and the material starts to get harder, it starts to naturally detach from the skin. So if you put a little bit of pressure on it and pull it away, you will see it's starting to detach. It's almost like a wound. You really don't need to do anything to keep this clean, and you don't need to unnaturally detach it. It will fall off on its own. What you could do is use a baby wipe or an alcohol pad along the edge where the umbilical cord meets the skin, and as you're gently holding onto it, you could wipe that area if there's some schmutz around the area, but you don't need to. It will fall off naturally. Sometimes there is an odor, and that's okay, as long as there is no redness around the umbilical cord, around the belly. If you see any redness, this could be a sign of infection, and you should make an appointment to see your pediatrician or go to the emergency room. It's not necessarily emergency, but it could be. So please talk to your doctor about what the next best step is to do if you do see redness around the belly area associated with the umbilical stump. Sometimes also what happens with the umbilical cord is when it falls off, there's a little red dot in the center, and this could be something called an umbilical granuloma. Sometimes these dry up on their own, but other times what we need to do is apply a special material to the belly button called silver nitrate, which we could do in the office, and that will help dry out the umbilical stump. If you have any questions about your baby's umbilical stump, please call to make an appointment.